Good morning. My name is Arthur. I'll be your nurse today. I'm gonna wash my hands, provide privacy, do the safety check. Can I get your name and date of birth? Sweetie Pie. Oh, thank you very much. Well, today we're going to do a postpartum and newborn assessment. I'm going to first ask the mom, the Sweetie Pie. Can you tell me your pain level from 1 to 10? No pain at the pain level of 3. Okay, that's not that bad. Can you go to the bathroom and empty your bladder for me? Alright, thank you very much. I'm gonna check your vital signs. I'm gonna check your temperature, your heart rate, respiration, and I'm gonna check your blood pressure. Everything's within normal limits. I'm gonna substitute the supine position. I'm gonna assess your breast for any redness, any pain, and any engorgement. Everything is in normal limits. I'm gonna inspect your nipples. There's no redness, cracks, or bleeding. I'm gonna check your fundus. And if it's boggy, I'm gonna massage your uterus until it feels firm, but that's fine. I'm gonna check your pad for bleeding. There's no bleeding. There's everything's no odor. Nothing smells. Looks fine to me. You've had all your babies natural, no C-section. Oh, that's very good. Then I'm gonna check for your episiotomy, for the approximation, for any edema or ecchymosis. Everything's normal. I'm gonna check your bladder function. There's no bladder distension at all. Can you tell me about your bowels? When was your last bowel movement? So it was today. Okay, that's good. I'm gonna check for your calf. Just check for any calf pain or tenderness or redness. Everything's with normal limits. Check for an edema of the hands or legs. See, I said you're bonding well with your baby. Good. That's very good. Assess your emotional status. Are you feeling any sad, happy? Oh, you're very happy you have your baby. Oh, that's very good. Now I'm gonna go do my assessment on the newborn. Check the baby's arms and legs are flexed. No, there's no abnormal flexion. I'm gonna do the vital signs of the baby, the blood pressure on the leg, and then I'm going to check the temperature, do the pulse, respiration, the blood pressure, and then I'm gonna measure, put the baby on the scale to check for the weight, and then I'm going to measure the length, the head circumference, and the chest circumference. And then I'm gonna palpate the skin. It's warm, pink to touch. And then there's no abnormal color of the skin. Palpate the head. It is symmetrical around. I feel the fontanelles. There's no sense of dehydration from the fontanelles. The sutures are approximated. Everything's with normal limits. Very good. And then I'm going to move on to the eyes. Looks good. I'm gonna do our perla with the eyes. They follow that's very good. And then we palpate the ears. Let's see, everything's good. The nose, check for patency. And there's no nasal flaring. Assess the mouth. It's pink and moist. The tongue moves freely. And we see that hard palate is intact, dome shape. You can suck the mom's thumb. The sucking reflex is present. The gag reflex is present. Now we inspect the neck, and then it's short and thick. It can turn the head side to side. Very good. Clavicles intact. Good. No head lag. And I'm going to palpate the chest. Look at the chest. Feel the xiphoid process. Equal chest expansion. No abnormal tissue or anything. I'm gonna listen to the heart sounds. The breath sounds. Good. And then I'm going to let's look at the abdomen. I'm gonna inspect the abdomen, and then I'm gonna also take the abdomen from the right lower quadrant and the right upper quadrant, and then the left upper quadrant and the left lower quadrant. Then I'm gonna palpate for any tenderness or anything. That's good to me. And I checked for the softness and its dome shape, and I checked for the ava. Everything's good. Check the genitalia, it's female. So check the labia and the labia minora and labia majorum. There's no edematous, no discharge. The erytherometus is present, midline. I'm gonna inspect the back. And then the spine is intact, midline straight, no masses, no dimple. There's no dimples, no Megollinius falls. There's no tuft on the hair because that would be present of spinal bifida. Everything's good. I'm gonna check the rectum. The baby did have the first meconium within 24 hours, so that's good. I'm gonna check for extremities. It's range of motion in all four extremities. There's equal length with the fingers and toes. The hands are fists. I check for the femoral and the peripheral pulses, dorsal pedius, tibialis. It's good. I'm gonna check for the moral reflex. Good. The grasp with my pinky. Good. And the Babinski reflex. That's good. And then I'll do a gestational age assessment. Check the skin. And I'll check for the lanugo, the plantar surface, the breast, the ears, eyes, ears, genitals, and then the neuromuscular maturity, good posture. So everything's within normal limits. And I checked for the arm recoil, the popliteal ankle, the scarf sign, and the heel to the ear. It's good. And then before I leave the room, make sure that the patient and the baby are comfortable. And then They have the call-out erase, the bed in low position. They have their personal belongings on the table. Is there anything else I could do for you today? Oh, thank you very much. You have a good day.